Thank you, Mr. Speaker. Colleagues, today I rise in strong support of Senate Bill 537A, a critical measure to protect our healthcare workers and to take a stand for those who show up day after day in some of our most vulnerable and volatile environments. Over the years, healthcare has become much more complex, from short staffing and COVID-19 to the rise in workplace violence. Healthcare workers need real changes so that our providers and their patients can feel safe again. This legislation is about prevention, accountability, and dignity. It's about saying clearly that no one should fear violence while simply doing their job, especially Oregon's nurses, clinicians, and care providers who are the backbone of our state's healthcare system. We know the facts. Healthcare workers are 5 times more likely to experience workplace violence than any other profession. Think about that. 5 times more likely. We also know that 1 in 4 nurses are physically assaulted each year. These aren't just statistics. I've spoken with nurses who've been punched, stalked, harassed, and who are afraid to go to work, Mr. Speaker. But they still show up for all of us. I was humbled and deeply grateful to the healthcare workers who have bravely testified on this bill and who have shared their incredibly painful personal experiences with me. But we have an opportunity to show up for them today. Senate Bill 537 creates clear, actionable standards for workplace violence prevention in hospitals and in-home health and hospice settings. It defines workplace violence in statute. It establishes patient safety flags and electronic records. It protects workers' privacy by allowing first names only on badges. It requires hospitals to install shatter-resistant barriers at emergency room intake windows and new or remodeled emergency department intake areas. It mandates trauma-informed response protocols when violence does occur. It also requires annual training, root cause analysis, reporting procedures, and protections against retaliation. And it further enhances worker safety in the home health care setting. This is legislation that has potential to change and save many lives. And I want to remind this body once again, 1 in 4 nurses are physically assaulted each year. These are our healers, and these truths should be unacceptable. I want to also make it clear that this bill is a solid start to a conversation that we must continue. Due to budget constraints, protections for workers at the Oregon State Hospital had to be removed, which means we still have unfinished business. These workers face some of the most complex risks of all, and I will continue fighting for their safety until the work is done. Colleagues, I am truly honored to stand here today to present this bill because this is personal. It is personal to our frontline workers. It is their reality, and I have been there. I've seen and experienced the exhaustion and the fear. I know those of us in this chamber value healthcare workers, but we must prove it. It's time to implement real policy for this issue, and let's make it clear that Oregon will not tolerate workplace violence in our hospitals or violence against workers who are helping to heal in our homes. Senate Bill 537 will give our healthcare workforce the safety they need and deserve to do their jobs. And with that, I urge your aye vote. Thank you.